Hello, everyone. I'm Lana Zak. Thank you so much for joining me. Federal officials are giving the green light to resume use of Johnson & Johnson's coronavirus vaccine. A CDC advisory panel voted in favor of using the vaccine on Friday. The single-dose vaccine will now come with a warning for some women. You'll recall that the vaccine was suspended early last week over reports of blood clots. CBS News has learned there have been at least 15 cases of the rare condition. 3 of those were fatal. The news comes as U.S. officials battle a fresh wave of vaccine hesitancy. Health experts warn dwindling enthusiasm could stall the nation's progress against the virus. Nikki Batiste begins our coverage in New York City.
Tonight, a CDC advisory committee is recommending the Johnson & Johnson shot rejoin the mix of COVID-fighting vaccines. But unlike the Pfizer and Moderna shots, J&J's will likely come with a warning about the potential risk of rare but highly dangerous brain blood clots. The 10-4 vote with 1 abstention came after hours of discussion and hundreds of pages of evidence.
The motion carries.
The committee concluded the benefits of getting the shot outweigh the possible risks, pointing out that as many as 45 adults could suffer a clot, but up to 1,400 lives might be saved. Tonight's vote comes just 10 days after the CDC suggested pulling the vaccine to investigate 6 cases of clots in premenopausal women.
This pause was essential to our ability to inform the public.
We're also learning tonight of 9 more potential cases, all in women. 3 have died, 7 remain hospitalized. Within 3 weeks of getting vaccinated, initial symptoms included head and body aches, fever, and chills. The brain blood clots are extremely rare. The CDC noted the risk was less than 2 cases per 1 million vaccine doses administered.
I think too many people may be scared off by taking the vaccine.
Health officials worry about vaccine hesitancy. Demand for shots continues to drop in some states.
All right, go to the right.
Unfortunately, everything plays into vaccine hesitancy these days.
A decision potentially puts about 10 million doses back into the pipeline.
And I am here at our large-scale vaccination clinic. And as you can see, we have lots of empty chairs.
Catherine Wells says the health department in Lubbock, Texas, has 7,500 vials already stored in this refrigerator.
If they allow us to use that, we will get that moving and get them into people's arms, because much more effective to be in an arm than in my refrigerator.
But there are other woes for J&J. Officials are still investigating contamination at J&J's Baltimore plant, operated by Emergent, forcing it to shut down. Officials are hoping the chance to be vaccinated here inside the American Museum of Natural History will convince more people to show up. The Biden administration says there are enough Moderna and Pfizer vaccines for all Americans who want one. Moderna said today it's working to have a booster shot against COVID-19 variants by early fall if it's needed. Lana?
Nikki, thanks. For more now, let's bring in Dr. Payal Patel. She is an infectious disease physician at the University of Michigan's Medical School. Dr. Patel, thank you for being here and for all that you do. So federal health officials have decided to resume use of Johnson & Johnson's vaccine with a warning label, but experts didn't recommend any further restrictions. What do you make of this decision, and what is the message that people at home should be taking from this decision?
Yeah, I hope that people will take away that there's some confidence in the way that we are thinking about vaccines, thinking about what could be related to those. You know, there were a couple vaccines that never were paused, so I would have people remember that. And moving forward, I would think about, and all of the evidence is there as you try to decide what vaccine you want to take and when you want to take the vaccine. People are trying to put as much research out there as possible for everyone to try to make that best decision moving forward. But I would trust in the decision that has been made today.
Well, the CDC says that this vaccine could save up to 1,400 lives and cause only a few dozen cases of blood clots. But the clotting cases that we've heard about appear to be more serious because many actually occur in the brain. I'm hoping you can tell us more about this. And do you believe there is still any cause for concern?
You know, one really interesting statistic that came out today from the CDC was in new cases since March, women in their 20s, 30s, 40s, 50s are often being the hardest hit by COVID itself. So if we think about all of the things that we know that can happen with having COVID, being hospitalized, getting blood clots from the virus itself, getting other sorts of infections associated with being in the hospital a long time. Those likelihoods are very possible if you have to get hospitalized, compared to this small chance of getting something that is very, very rare and may be avoided altogether by choosing one of the other vaccines.
Well, I want to ask you about the idea of choosing another vaccine, because Johnson & Johnson says that its vaccine is valuable and has the ability to, quote, reach locations in the U.S. that other vaccines may not. If you are a woman, if you are a female who is in that age range, potentially at risk for these blood clots, and have the ability to choose another vaccine, would you recommend that?
You know, this is a great question. Sometimes in medicine, I often will try to make a decision with my patient, and I will present them the risks and kind of the odds. And what I would say is, you know, all of the information is out there. You can make the decision. The decision to get a vaccine is definitely the right one. The longer that we stay unvaccinated, we put ourselves and our families at all sorts of risk. So getting a vaccine is the first decision. And then thinking about, are you going to go for your second dose? Would you rather just get one shot and be done with it? Those are some of the things that I would think about as you're trying to think about the different vaccines.
Well, the U.S. recorded more than 3 million coronavirus shots on Friday, but the 7-day average has been lower than previous weeks. I'm wondering if you're concerned that the pace of vaccinations will continue to slow. We saw Nikki at the Museum of Natural History trying to encourage people to come by being in a location that a lot of people like to go to. Do you think that those sorts of things are actually effective in persuading people to get a shot?
Yeah, you know, we look across the globe and we see how many people are trying to be admitted to a hospital, how many people remain unvaccinated in countries like India. And we are lucky enough to have a glut of vaccine available for Americans. What I would say is remember how lucky we are not to have 1, 2, 3 vaccines that we could choose from here. And I think that is going to be really important as we try to bridge back to normalcy, is really trying to choose one of those vaccines and getting vaccinated quickly.
I want to talk. You mentioned the global fight against the coronavirus. But before we even get into that, I just want to know, what do you say to people who say that they don't want or they don't need the vaccine?
You know, usually my first question is, tell me about why. You know, I don't want to preach to you. I want to hear your questions. And often there's rumors or there's misunderstanding perhaps about a headline that someone sees. I try to understand the question that someone might have. I try to give them facts about what the truth is about vaccines. And usually I do find that that's really helpful in meeting somewhere in the middle.
Well, coronavirus cases, as you mentioned, are surging around the globe, including in India, Germany, Colombia, and Turkey. What's America's role in this global fight?
Yeah, it's a great question. You know, I think we have to start thinking of it as we're all in this together. In infectious diseases, you know, there's not really any borders. We know now, we've seen it before, and we'll see it again. Viruses don't care where you are. So what I would say for the average American, what we can do is try to get vaccinated and slow the wildfire of the pandemic here. And then we also need to be thinking as a public health community and as a nation about how can we get most of the world vaccinated so that we can start traveling again, people can start doing business again. These are going to be really important. We can't just kind of stay in our own lane. We have to think about it as a global team.
All right. Dr. Payal Patel, thank you.
Thank you.